Good afternoon, everyone, and welcome to the Board of Pharmacy's webinar today. I'm Tom Glinsky, Chief Inspector with the board, and with me today is Kimberly Grinston, our Executive Director. Before we get started on our 2023 legislative update, I'll just go through some basic slides in case you haven't been on our program before. All participants are muted. If you have any trouble with audio on your computer, there is a dial-in option. If you go to your toolbar, you'll see instructions on how you can dial in if you need to use that method. This has been approved for 1 hour of Pharmacy CE. Computer sharing is not allowed. In order to get CE, you must be logged in to the GoToWebinar website under your own username. We do not issue credit if you're just listening to the webinar over the telephone. I'll give more instructions at the end of the webinar on how to obtain CE. Remember to save your certificates. We'll email them out to you within 15 to 30 days of the webinar. And a reminder, we do not report to the CPE monitor. Handouts. Today we actually have 2 handouts. We have the slides handout, and then we also have a copy of an emergency rule as a handout too. You can find those on the board's website under upcoming events, or if you go to your GoToWebinar toolbar down at the bottom, there's a handouts tab, and you'll see both of them there as a PDF. We do record our webinars and post them on our website. We do have all our previous webinars posted. We will take questions today. If you'd like to send us a question, go to your toolbar, type it in, and hit send. Today's topics, Kim's going to tell you about some new board members we have, and then she'll give us a legislation update. And then we're going to do this different today. We're actually, after Kim's done with that, we're going to take a question and answer session just on legislation questions. And then we'll go back into a rule update and take questions at the end again. So I'm going to turn it over to Kim.
Thank you, Tom, and good afternoon, everyone. And thank you for joining us on the board's annual legislative update webinar. We have a series of changes that we need to go over today. I want to echo what Tom said. We are already receiving questions in the Q&A box, but we will be taking questions at the end of the legislative portion. We've had a lot of questions come into the board office, and we want to make sure we get to as many as we can. So please feel free to type in your question as we're going through the program. Once we finish the legislative section, I will stop and take and try to answer as many questions as I can. Hopefully we'll have enough time to finish everything before the end of today. Before we get started, I want to do a very important board update. We'd like to welcome our new board members. For those who may not be aware, we've had 2 new board members appointed to the board, Tammy Thompson and Darren Harris. Both of them are pharmacists from the Kansas City and Kennett areas. So we'd like to welcome them to the board, and we look forward to working with them as we move forward. Now let's get started with our topic of today, which is 2023 legislation. So we had several bills passed this year that included legislation for pharmacy or related to pharmacy. I want to do a general disclaimer. I'm an attorney, but I cannot provide legal advice. So what we share today is not legal advice. I am also not officially speaking, legally speaking on behalf of the board. We are just doing a general summary of some of the legislative changes that passed this last session. There may be other legislation that passed that may impact your practice or some of your other business activities. We are just highlighting the ones that we were watching and monitoring that may impact pharmacy practice. All legislation that we talk about today will become effective on August 28th, 2023. As you'll see from the board's website, and as you've probably already heard, we've already begun implementation of some of the provisions so that we have a seamless transition to the new language after August 28th. But these are a list of all of the main legislative pharmacy-related bills that we were tracking this year. You'll see Senate Bill 45 highlighted because I believe that includes includes the majority of pharmacy-related provisions. I would encourage anyone or everyone to take a look at each of these bills. If you go to the Missouri General Assembly's website, there is a bill tracking mechanism, and you can find links to each bill. Also, the new legislative provisions are already posted online. And so if you go to the board's website, look at statutes and rules, you will see not only the current version of the statute, but also the statute that is changing effective August 28th. Make sure you're looking at the right statute as you move forward, but these are available on the board's website, currently in statute and not by individual bill numbers. So we had 4 categories of changes this legislative season, or that will be effective on August 28th. There were a few general changes, and we'll start there first. Then we'll talk about changes to pharmacist scope of practice, which is where we've had the most questions so far. We'll talk about some changes for mid-level practitioners, and then some other miscellaneous changes. For those of you who may not know, we did publish a supplement to the practice guide, and it was released actually yesterday, but it is dated today. And it includes a general summary of a lot of what we're going to talk about today, including more in-depth compliance information. If you go to the board's main webpage and you look under the news section, you will see a link to the practice guide supplement there. It's also under our publication and resources are on that page as well. So I would encourage you, if you haven't already, to go to the board's website to look at the practice guide supplement. We will be doing a comprehensive practice guide revision at the end of the year, early next year. But for now, we wanted to provide some guidance for licensees as we transition to new legislative language after August 28th. So let's get started with general changes. One of the general changes was to DHSS standing orders. So Missouri law will now allow pharmacists with a medication therapy services or MTS certificate to provide flu, group A strep, and COVID-19 medication therapy services pursuant to a statewide standing order issued by the Department of Health. If you read the language, the provisions would allow pharmacists to order and administer treatment, as well as possibly test to treat, depending on the DHSS standing order. But I would note that that is limited just to flu, group A strep, and COVID-19. To implement these provisions, joint rules are required with the Board of Healing Arts. And of course, the Department of Health has to also issue a standing order. So these provisions are not effective as of today. We will be working on these during the upcoming months. So just so that you know what will be effective or allowed in the future, but as of today, we have to wait for joint rules to be completed. Another provision that passed was on public health emergency and vaccines. This is reminiscent of what we experienced during the pandemic, but Missouri law has been amended to allow pharmacists to order and administer vaccines to treat a public health need as authorized by a state or federal agency during a state or federally declared public health emergency. You would note that this language is not general. There must be a state or federally declared public health agency, and there must be some form of governmental organization. Significantly, this portion does not require joint rules, so this is effective now without any additional regulatory action from the Board of Pharmacy or the Board of Healing Arts. However, of course, a state or federal agency would need to issue a qualifying emergency order and/or authorization. So public health emergency and vaccines, I think this was a good change as we learn lessons and really download from the pandemic and how we would be able to better serve Missouri patients. Senate Bill 49 includes language on gender transition healthcare services. You will see a general description of the bill here. It prohibits healthcare providers from prescribing or administering medication identified as cross-sex hormones or puberty-blocking hormones for the purpose of gender transition. There are exceptions that apply to that, including some exceptions for patients on ongoing therapy. Administration of prohibited medication is deemed unprofessional conduct, and the statute provides the license shall be revoked if there is a violation of the statute. We advise you to consult with legal counsel and review the language independently. The board doesn't have any additional direction on this. We are not anticipating any joint rules because I believe the statute is self-executing. However, please be aware that this is currently effective. And again, links to the change language would be available on the board's website under the statutory section. Now let's talk about some of the major changes this year, primarily to pharmacists' scope of practice. Let's start with medication therapy services, which may actually be one of the easier changes. So as many of you know, and many of you have submitted comments to the board in the past about MTS services, under the current rule and under the current statute as of today, a patient-specific prescription is required for a pharmacist to provide MTS services. That language has been amended effective August 28th, 2023. And now a patient-specific prescription is no longer required. Instead, MTS services can be provided pursuant to a protocol with an authorizing physician for the physician's patients, unless the protocol provides otherwise. So the idea of getting an individual MTS prescription for each individual patient would no longer be required under the statute. Instead, the protocol physician could allow sort of a population health approach and allow MTS services for those patients of the protocol physician. This change would not impact patients of other physicians that are not subject to the protocol. So it's unlike the protocol, immunization protocol that you may be used to. Again, these are only patients of the protocol physician, and there must be an established physician-patient relationship. Interestingly, the statute says that patient-physician-patient relationship must include an in-person encounter through a medical interview and physical examination. So it appears to suggest that telemedicine could not be used to establish the initial physician-patient relationship, but of course could be used on an ongoing basis. Although the patient-specific prescription requirement has been removed from statute, the statute still requires the Board of Pharmacy and the Board of Healing Arts to promulgate joint rules to implement the new provisions. So at this time, a patient-specific prescription is still required under the current joint rule. Until the joint rule is amended, a patient-specific prescription would still be required for MTS services provided by a pharmacist in Missouri. So again, the statute has changed. However, the rules need to be updated as well. We have been working, and we will start the process of working with the Board of Healing Arts. When I say we, I mean staff of the Board of Pharmacy, to amend the MTS rule. The immunization rule took priority, which we will talk about on the next slide, I believe. But hopefully we will see a promulgated rule to implement the MTS changes in the near future. Let's talk about immunization expansion, which is probably the question that we get the most at the board office right now. So I want to echo first, reiterate that changes will be effective August 28th of 2023. Senate Bill 45 substantially revised Section 338.010. Significantly, it really changed the layout of the statute so that it is much easier to read right now, instead of all of the pharmacists or the definition of the practice of pharmacy in one conjoined paragraph. The statute separates out 338.010 into several sections, including a subsection 4 of paragraph 1. And that now provides, it previously provided that pharmacists may provide or administer designated vaccines by protocol. Effective August 28th, the statute now provides that pharmacists may order and administer all FDA-approved vaccines, with the exception of the list that you see on screen. And so I'm not going to read the list to everyone. It is in statute and also shown on your screen right now. But the vaccines that are listed here cannot be ordered or administered by a pharmacist under 338.010.14. And we'll talk about other allowances in just a moment. But our traditional, has been known in the past as the Protocol Immunization Authority, that has now been amended. First, it adds the authority for pharmacists to order and administer, and it also removes the requirement for a protocol. So if subject to joint rules of the board, and we'll talk about that in just a moment, a physician protocol is no longer required to order and administer vaccines authorized under 338.010.14. And I keep using that subsection because another subsection has other provisions, but we'll talk about 010.14 right now. And so the exceptions there, I think, are you can read them in the practice guide supplement. We included the current list of FDA approved vaccines with vaccines that are not allowed under 010.14 stricken. So if you have a question on what is allowed under the current vaccine list, you can go look at the supplement. There is a guidance document from the FDA with staff notes that has been provided. The other portion of Senate Bill 45, which again has engendered several questions, provides that pharmacists may also not order or administer, or restricts a pharmacist from ordering or administering any vaccine approved by the FDA after January 1st, 2023. We'll talk about what interpretation of that language in just a moment. But now in statute, any vaccine approved after January 1st, 2023 would not be subject to 010.14's immunization authority for pharmacists. Joint rules were required with the Board of Healing Arts. I want to commend the board because the board was very concerned about the impact of the new legislation on pharmacists' immunization authority without additional clarification, especially for the upcoming flu season. So we met with the Board of Healing Arts on July 28th. The board drafted an emergency and proposed rule to address immunization authority. The Board of Healing Arts approved that rule without changes. That rule has been filed with the Secretary of State's office, and the joint rules that are required by Section 338.010 will be effective on August 28, 2023. It's an emergency rule. That emergency rule has been filed with the Missouri Secretary of State's office. If you go to the practice guide supplement, there is a link to the emergency rule. Or if you go to the Secretary of State's website, there's also a link to the emergency rule. We will also be posting another link to the emergency rule on the board's website. We hope to have that posted by tomorrow. But again, you can, if you go through the supplement, that link is already posted so that you can see the terms of the emergency rule to address immunization authority on changes effective August 28th, 2023. So let me walk through what the emergency rule does. It, number one, maintains a physician protocol as an option, but it is no longer required. Now, I understand that many pharmacists may continue to use a physician protocol for billing purposes, but under the statute and also under the emergency rule, which again will be effective August 28th, a physician protocol is an option, not required. The emergency rule, importantly, also clarifies that the January 1st, 2023 FDA approval date does not prohibit administration vaccines that were initially approved before January 1st, 2023, but reformulated. Good example, before January, but it is updated, reformulated after the January 1st date. Those vaccines may still be administered by a pharmacist under 338.010.14. They can be administered by protocol, or they can be ordered and administered independently by a pharmacist. I want to note that this is a significant expansion of pharmacists' immunization authority, that recognition of independent approval. However, that vaccine restriction date has been clarified in the emergency rule. So we have a lot of people asking, can we still give annual flu vaccines? The answer is yes, once again, if the vaccine was initially approved before January 1st, 2023. And I see we've got questions coming in, and we'll address those as soon as we finish the legislative section. Other provisions of the emergency rule, and there was a proposed rule that was filed to match the emergency rule that will go through the regular rulemaking process. There is a public comment period on the proposed rule, but not on the emergency rule. The emergency rule will be effective August 28th, The proposed rule will go through the normal public comment period and will be posted in the Missouri Register. The emergency rule also allows prescriptions to be either in the pharmacist's name or the protocol physician's name. This references and/or highlights that independent pharmacist authority to order and administer approve the listed vaccines. So if you are not operating under protocol, even though I understand several pharmacists, most pharmacists may be, if you are not, you are now able to create a prescription as you would have done under protocol in the pharmacist's name as the prescriber. The emergency rule recognizes the patient care concept. It requires a patient medical record, which is consistent with other healthcare practitioners. We incorporated similar language in the HIV PEP rule, and I think in the nicotine replacement therapy rule, requiring pharmacists to maintain a patient medical record if you are the ordering and administering pharmacist. Again, those requirements are listed in the emergency rule. Pharmacists would still need to file a notification of intent with the board. Again, notification of intent to immunize is different from a notification of intent to immunize by administration. We recognize that the NOI section for still references a protocol. We are working on amending that, and we hope to have that NOI page updated. We will before August 28th, so that you all, everyone who needs to file an NOI can do so. You do not need to file a new NOI under the statute. If you had one already in place prior to the statutory change, you don't need to file a new one until you renew again. So there's no need to file a new NOI just because the statutory provisions have changed. And the emergency rule maintains current authority for qualified pharmacy technicians and intern pharmacists to immunize under a pharmacist authority. I want to point out that the rule says now provides that techs, interns, pharmacists must be competent to perform the services provided. This language is included currently in 2.010, so it's not new language for purposes of board regulation. However, I would note, since the chapter 338 now expands immunization authority, pharmacists should ensure that your qualified technicians and intern pharmacists are competent to perform or to administer other vaccines that are now authorized under chapter 338. The rule provides both emergency and proposed that a pharmacist must complete an immunization certification program. That's not new language. However, we did add language that if you are seeking to pharmacist, if you are seeking to administer by a new route that was not included in your certificate program, that you must complete training in the new route of administration with the licensed healthcare practitioner prior to administering via the new route. And so again, this language, I believe, comes over from 6.040. So it is not new language, but it is new to the immunization rule. So please be aware of that. Please note that your protocol may be stricter than statute. So your protocol may provide additional restrictions and or maintain current restrictions, including on the list of authorized vaccines. If your protocol is stricter, then the protocol controls if you are immunizing under protocol, although the protocol is no longer required. We've received questions already about the new RSV vaccine that was recently approved. The RSV vaccine cannot be ordered or administered by protocol under 010.14 or independently under 010.14. Because it was approved after January 1st, 2023. So the RSV vaccine could not be administered. However, and this is one of the reasons why I made notes on or emphasized the statutory sections here, section 338.010.13 still maintains pharmacist authority to administer by prescription order. So while RSV cannot be administered by protocol or independently ordered and administered by a pharmacist, it could still be administered by prescription order under 6.040. You would still need to require to comply with 6.040's training requirements, and also a separate notification of intent is required to administer by prescription order. If you're authorized by your MTS protocol, you could also provide or administer the new RSV vaccine under your MTS protocol. Again, if you're authorized, you would still have to comply with 6.040 and the notification of intent requirements as well. So RSV vaccine can still be given, but it can only be given by prescription order or pursuant to an MTS protocol. It cannot be given under protocol under 010.14 under the new statutory language. So that's just a summary of Vaccine Authority, and I see several questions have come in, and we'll get to those in just a moment. Before I do that, I'd like to walk through just a few other additional changes that you might need to be aware of. First, let's talk about changes to mid-level practitioners. The nursing language was amended to allow nurses to prescribe non-controls within the scope of practice or specialty. Of course, APRNs do this today. There is a question about whether a collaborative practice agreement is still required to prescribe non-controlled, or whether the new language gives APRNs independent authority to prescribe non-controlled. The Board of Nursing is reviewing that question, and they haven't answered that as of yet. Right now, we understand they are advising, they meaning the Board of Nursing, they are advising licensees that a collaborative practice agreement is still required. So just be aware of that as you receive these prescriptions. Language also was amended to allow APRNs to dispense or to administer drug samples for free at no charge to the patient or any other party, meaning they can't bill insurance. I don't know that this will impact pharmacy necessarily, but it's just an FYI. Expanded C2 authority for hospice patients, and this is updated in the practice guide supplement. APRNs and physician assistants can now prescribe C2s for hospice patients if authorized by their governing collaborative practice agreement. This wasn't authorized previously. The statute doesn't have any quantity limits or any limits on what types of C2s can be prescribed for hospice patients, like we see for hydrocodone right now. The statute provides an APRN or a physician assistant must be employed by the certified hospice provider, which I think is key language here, because again, it says they must be employed by the hospice provider. We understand that most time pharmacists may not know if a APRN is employed by a certified hospice provider. We would remind pharmacists of their corresponding responsibility to ensure controlled substance prescriptions are issued for a legitimate purpose. Good faith efforts should be made to make sure if you see a C2 prescription for a hospice patient that the nurse or the prescription meets all necessary requirements. This new allowance does not apply to assistant physicians. It only applies to APRNs and physician assistants. PA prescriptions have been, the requirement for those have been changed. They no longer have to include the supervising or collaborating physician's name on a PA prescription, so you may see some of those prescriptions changing going forward. However, the collaborating physician's name is still required for APRN and assistant physician prescriptions. Now, for PAs, the supervising collaborating physician's name requirement was included in statute. For APRNs and assistant physicians, the requirement is actually in the Board of Healing Arts and the Board of Nursing's rules, and the rule would need to be amended. That was never statutory, amended, I'm sorry. That was never statutory. So for PAs, at least for now, the supervising collaborating physician's name is no longer required on the actual prescription. And I don't know if the Board of Healing Arts and Board of Nursing will be making any changes for APRNs and assistant physicians. Prescription container labels, we talked about changes to the prescription. Now let's talk about changes to required container label information. The container label no longer needs to include the name of the prescribing APRN or physician assistant. Previously, that was required on the container label, and I do know that space is premium on container labels, so that removes one additional requirement. The requirement never applied to assistant physicians. So assistant physicians never, for those prescriptions, you never needed to include the supervising or collaborating physician's name on the container label. That language has just moved over to APRNs and physician assistants as well. A couple of miscellaneous provisions before we begin taking questions. The Chapter 338 and Chapter 195 was actually amended to allow pharmacists and qualified first responders to sell or dispense naloxone. That language was currently in statute, or an opioid antagonist. That definition of opioid antagonist has been expanded to include medication that blocks the effects of an opioid overdose. that is approved by the FDA and administered in compliance with FDA requirements. I would just encourage everyone, for those who may be dispensing to your local, maybe EMS services and/or some of your local first responders, law enforcement, that language may impact you and now allows dispensing of a wider range or distribution of a wider range of opioid antagonists. The Section 192 was amended to create a voluntary non-opioid directive form that allows a patient to designate whether they want to receive a prescription for administration of an opioid. It's very much like an advanced directive form that you would otherwise see in healthcare. A patient can basically sign a non-opioid directive form that says that I do not want to be dispensed or administered an opioid. The Department of Health has to promulgate rules to implement this provision, so it is not implemented as of yet, although it is in statute. The form does not currently exist. There is a presumption created in the new language that a prescription presented at an outpatient pharmacy is valid, and a pharmacist cannot be held for dispensing in opposition to a non-opioid directive form unless they knowingly acted against the directive form. So you would have to have some level of knowledge that the form exists and that the patient has requested or asked not to be prescribed or administered an opioid. The statute references outpatient pharmacy. That's not defined. Also, there's a reference to outpatient settings as well. That is not defined in statute, so we would suggest that you talk to legal counsel about how that is construed. But once again, this directive form is not in place as of yet. Monitor the board's e-alerts for additional updates. Finally, the last two very quick changes: fentanyl test strips. Missouri law was changed to allow law enforcement to possess and sell items to detect fentanyl. In the past, I believe these may have been defined as drug paraphernalia. Pharmacies can now sell and dispense these fentanyl test strips. This is just an FYI. I don't know that it will directly impact pharmacy practice. And then finally, just an interesting provision, Missouri law was amended to add a tax credit that grants employers a reimbursement tax credit for costs expended on employee upskill credentials. Significantly, this includes healthcare focused credentials, which could arguably, I don't know this for sure, it might include technician certification or maybe other pharmacist certification costs paid by employers. I just thought this was an interesting change in Missouri law that pharmacy may be able to take advantage of in House Bill 402. Once again, I would suggest that you review the practice guide supplement. I know that we're going through a lot of this information very quickly. There's additional information in the practice guide supplement, and of course, you can always ask questions to the board. So we're going to stop here and take some questions on 2023 legislation. If you'd like to ask a question, you see the question box down in the bottom. As we review questions, I know one of the first questions that we received was whether the board would be removing the 50-mile requirement from the MTS rule. That requirement, the board has always been in favor of removing that from the MTS rule. However, the Board of Healing Arts has asked that it remain, and since we have to promulgate a joint rule, we added that at the Board of Healing Arts' request. As we amend the MTS rule, I do anticipate that the board will once again request that the Board of Healing Arts remove the 50-mile restriction. The board has spoken favorably on that issue in the past. Let's see, we have a few additional questions.
This one came in while you were talking about the standing order from the Department of Health on flu, strep A and stuff. They wanted to know what happens if Board of Healing Arts doesn't respond by 8/28 in the joint rules.
We don't anticipate that the Board of Healing Arts, that rule will not be effective before August 28th to implement standing orders for COVID-19, strep A, and flu. So that will not be effective. So the provision will be there, but it will not be implemented as of yet. We anticipate we will need to talk with the Department of Health also about implementing that. I don't know when it would be effective. Once we do that, we'll have to go through the joint rulemaking process, which could take 6 to 9 months. So I don't anticipate that rule being fully effective until 2024 at the earliest, absent another emergency need that would allow us to proceed with an emergency rule.
Also on MTS, someone's asking, does that apply to ambulatory care clinical pharmacists providing care?
Yes, yes, it would. It would. The MTS rule does not make a distinction.
Someone wants clarification. Can the pharmacist be the prescriber on an immunization ordered by a pharmacist? And will insurance companies cover that?
Okay, so I cannot answer the insurance company question because it depends on whether you're credentialed and whether they recognize you as a provider, but I can tell you that the rule does allow the process. So yes, a pharmacist could be listed as the prescriber and can independently order and administer authorized vaccines under 010.14. Once the emergency rule becomes effective August 28th, you will have to talk with insurance companies and providers on whether payment is authorized under that. But you do now have legal authority.
Got a couple questions on delegation under the
Sure.
new immunization language. Can a pharmacist ordering it be delegated to a nurse to administer it?
The answer to that is yes, but we have some guidance in the main practice guide about how that delegation can be done to another healthcare provider. They're going to need to be administering under their own authority.
Right. I think what they're asking is, can they delegate the pharmacist's authority to a nurse who doesn't have their own standing order? I believe our current rule would need to be amended because it says who you can delegate to is only an intern and a technician.
That's correct. That's correct.
So the language Kim's referencing in our practice guide talks about how if a pharmacist wants to bring a nurse in who has their own standing order and still be able to bill for it, we have some guidance on that. And then someone else is asking about, can one pharmacist order it and delegate it to another pharmacist to administer it? I don't know. Again, I think it goes back to the current rule says a pharmacist can only delegate to an intern or a technician. So I don't know if we know the answer to that one.
Yeah, we'll have to think about that one. We'll have to think about that
It
one.
might be something to think about when we revise the rule to allow further delegation on that. Someone's asking about qualification for other routes. Who is a qualified trainer? Would a PharmD be that? The answer would be, the rule says a licensed healthcare practitioner who's trained, who's authorized in that route. So a pharmacist who is trained for that route would qualify. So they could be, and they also want to know, how do you track that? The rule just says you're required to document it and including the date. So I would just list what the training included and who did it and the date of that training. We have someone asking about technicians as immunizers. Must they still be certified and have 1 year's experience?
The answer is yes.
Yeah, that part of the rule did not change in the emergency rule.
But again, we encourage pharmacists to ensure competency because techs will be giving other vaccines if allowed by protocol. I want to make a note on protocols as well. We encourage all pharmacists to go back and review their protocols. Just because the statute has changed, again, your protocol controls if you are still administering by protocol after 8/28. If your protocol does not allow the expanded list of vaccines authorized by the statutory revision, then you are not allowed to do it if you are to administer the vaccine if you are administering by protocol. So please go back and check your protocols to make sure it includes any changes.
We want clarification on RSV vaccine. Can we add that to our protocol?
Not to protocol. It can be administered by prescription order because the statute says that pharmacists cannot administer under 010.14 any vaccine approved after January 1st, 2023. So even if authorized by an immunization protocol, you cannot. Now, an MTS protocol would be different, and we talked about that earlier. You would still need to comply with 040, but an MTS protocol may be an option, but not under an immunization protocol under 010. We've also received a question about combination vaccines. So I understand that there is a COVID flu vaccine that may be approval that may be in the works right now. We will have to take that question back to the board and consult with legal counsel on that. We can't provide additional advice at this time. We, in our original discussions, we just talked about single vaccines, but for combo vaccines that were both approved before January 1st, 2023, we'll have to talk with legal counsel, and we may give additional guidance on that in the future.
We have a couple asking about, clarify where COVID falls in under this new authority.
So COVID would fall under the authority under 010.14. You can order and administer that under the new provisions. It can also be added to a physician protocol as well under the new revisions of 010.14. It also, and of course, those are COVID vaccines approved before January 1st, 2023, and updates for a previously approved vaccine. So that is there. We also have the public health emergency language and the DHSS standing order language that is applicable as well. But COVID-19 vaccines would fall under the new statutory revision and would be authorized.
Someone's asking if we can go back to the slide before the fentanyl test strip. I don't know if they have a question or if they just want to see that.
There you go. The non-opioid directive.
So if you have a question about that, send it in. I don't see you actually asked a question. Someone wants to know, can technicians administer vaccines other than COVID and flu, such as meningitis and Tdap?
Yeah. And the answer to that is yes. We do allow delegation of that under the rule. They must be competent. They have to qualified pharmacy technicians, so they have to meet the qualifications of 6.050. Not all technicians are authorized to immunize. So the answer to that question is yes. If a pharmacist is authorized to give it, and they're under the direct supervision of a pharmacist who has met the qualifications to immunize under 010 and under 6.050, the rule. Then yes, they can administer the additional vaccines.
We got a question about the tax issue that you
Yes.
talked about. They want to know will that will you have to forward that money on to the person getting the training?
I have no idea. I have no idea how that tax credit works. It just says under the current language that that the tax credit is granted to the qualifying employer. So yeah, I check with the revenue and or read the statute. Can't advise there. I stay very far away from anything tax law related.
Do you anticipate the January 1, 2023 immunization date being updated regularly, or what's your thoughts on that?
So my understanding was that that date was a product of negotiation with the Missouri State Medical Association while the bill was in discussions at the General Assembly. I can tell you that the Pharmacy Association groups, the Board of Pharmacy, expressed concerns with that date and statute. It was their intent that the boards or the associations would ask for general legislative approval for any new vaccines under the language. We have had some very preliminary discussions with the lobbyists for the State Medical Association and also with MPA about possibly removing that date restriction. It is a goal of the board. We do believe that it complicates and unnecessarily ties the hands of pharmacists on an ongoing basis. So to the extent that we have the opportunity, we will be looking to remove that. But of course, that is subject to the legislative process.
So going back to MTS, they want to know, will we still need that individual prescription until the rule changes?
That is correct, yes. Yes, you will until the rule changes. And in fact, we anticipate beginning drafting on that rule, hopefully within the next few weeks or so, once we move past the initial August 28th effective date. And hopefully we will have something out on that shortly. Of course, register for the board's e-alerts because additional information will be provided in the e-alert.
Someone's still wanting more clarification on the tax one, which I don't know if we're the agency to give that.
Yeah, I don't. I would suggest please look at House Bill 402, go to the General Assembly's website, and you can just do a bill tracking search for House Bill 402 from this year, and it will provide you full rule language. I don't think we can provide any additional information, but to the extent if it is allowed to be used for pharmacy, I think that's a good change for pharmacy.
Someone's asking how about delegation to graduate interns. So I think their graduate intern, they're talking about someone who's graduated pharmacy school but are not yet licensed. You can delegate to them as long as they're licensed with us as an intern and meet the rule requirements. So there is no difference between them and an intern who's in school, as long as that.
As long as they have an active intern pharmacist license.
They want to know about COVID being reformulated. Will they still be able to do that? The answer would be, yeah, it was approved prior to January 1, and the emergency rule says any reformulations of those would qualify. What Kim was, if there would be a combo of COVID plus flu. We don't have an answer to that yet. We're still seeking legal advice on that one.
Okay. That it looks like we've gotten through most of our legislative questions. Now we're going to switch over. Tom is going to walk you through some of our rule changes.
Okay, just briefly, we'll go through some of the recent rule changes the board has accomplished or is working on. The well-being program, if you're familiar with that, that was a program to help pharmacists who may have a substance abuse or impairment problem, and either board directed to the program or voluntarily they go in the program. The board has never got that up and running since it was originally created by statute. The board revised the rules to make it easier to contract with someone to run the program, and that happened in July, and we're happy to announce we've already have someone contracted for that, and we hope to be announcing in the near future that that program is up and running. So just be on the lookout for alert about that on how pharmacists and other licensees can take advantage of that program. The board's been working on revising the compounding rule 2.400 standards of practice. These will become effective, the things I talk about here, on September 30th. They become effective. First involves bulk drug substances. The board has incorporated similar language to what the FDA requires on bulk drug substances into our rule. So this FDA requirements that bulk drug substances be part of a USP monograph, a part of a FDA approved product, or be on one of their bulks list or a category list. We now will have language that mimics that. And then the board expanded the definition, put more clarity into it, what a commercially available product is. There are new phrases that are defined. Essentially, a copy of commercially available product and easily substitutable are also now defined in the regulation. And then it gives more specifics on how you document when you are compounding a commercially available product. And then the board created a new rule. This kind of stemmed out of the pandemic, where there was allowances for hospitals to do some non-patient specific compounding to alleviate drug shortages. And then the board had to do an emergency rule when we had a contrast media shortage. I believe it's been 2 years now. So the board has taken those two instances and decided to just write a rule that would allow a Class B hospital pharmacy to do non-patient specific compounding to alleviate a drug shortage. It's for when that product will be administered to patients in a facility of the same hospital system. So it's not just within, the hospital. It could be a hospital compounding it and sending it out to a surgery center or somewhere else that's part of the same system. Just caution, this only applies to Class B hospital pharmacies. Hospital pharmacies that aren't licensed with us, it would not apply to. And then any other Class A or other type, it would not apply to. Just while we're talking compounding, the board has announced it will delay the enforcement of 2.425. That's the required pharmacy reporting regulation that was created a couple years ago to meet the requirements for the FDA Memorandum of Understanding. Because that Memorandum of Understanding has not been officially put out there by the FDA for states to sign, Missouri has not signed it yet. The board has delayed enforcement of that reporting until January of 2025. So pharmacy's first reports currently will be due by January 31st, 2025, and it will be encompassing the compounding data for the year 2024. So again, watch announcements for this. The board won't proceed with this until the memorandum of understanding is more definite. And then the board's been working on some proposed rules for Class N and Class O automation. The current rule 2.900 is encompasses both automation at a long-term care facility and also in an ambulatory setting. The board has proposed splitting those up into two separate rules. The numbering may change on these, but right now this is what we believe the numbering might be. The board has approved these at the July meeting. Staff is currently working with the division staff to get them finalized and get approved so they can be published by the Secretary of State for public comment. We hope to have that done in the near future, and you see that. But the new Class N, which we already have a number of those operating in Missouri, you won't see a lot of change to that. The Class O rule has been modified a lot. It will now encompass both a total dispensing system where the system does all the packaging, labeling, and everything, but it will also now include pickup devices where a pharmacy can put in a filled prescription in a device and patient can come pick that up from that device. So it will allow some greater opportunities for pharmacies to use automation. So watch for those rules to be published for comment. Okay, so we'll now get back to taking some questions again.
And Tom, as you're looking at questions, I just wanted to add just one note, which is not quite related to legislation and rules, but just to an issue that is, of course, coming into the board office. We are getting a lot of patient calls because of the Adderall shortage of ADHD medications. We understand that pharmacies may have limited options right now, but we would suggest that you advise patients. We have patients who are just being told that the pharmacy can't fill it, and then when we contact the pharmacy, we realize they can't fill it because it's not in stock. I think patients should be informed of that. That would help. It would eliminate a call to our board office and also help them manage the therapy as well. So, alrighty, Tom, additional questions?
Someone's asking about test and treat. Is there any allowance for that currently, and where are we at going forward with pharmacists getting the authority to do that?
So the only thing that we have currently is the language that will be effective August 28th for flu, COVID-19, and Strep A. But again, joint rules are required to implement that. We have some language in the practice guide about CLIA-waived testing, a little bit different than test and treat, but that statutory language is the only language that would relate to that right now. And of course, MTS, our MTS rules, MTS statutes would allow test to treat if authorized by protocol in some instances.
We have someone who wanted to know, does the board have a comment on the new Medicaid regulations such as medicine packaging and stuff like that?
The board does not. We do not have a comment right now. We would suggest you talk with Mo Health Net on that one. Someone is asking, is the board considering adopting the new provisions of 797? The answer is the board will be reviewing it over the next couple of weeks. Actually, I think will be on the October board meeting agenda. So we are going to be reviewing 797 and also the accompanying chapters now, 795, 800, and 825, to see if and how those should be incorporated into Missouri law. So please stay tuned for that.
Some questions on fentanyl test strips. Are you required to provide education if you dispense those, and do they have to be behind the counter?
I don't think the statute provides any additional requirements, but don't quote me on that. If you can go back through materials and go back and read statutory language, I believe the statute is just very broad right now, and so.
It would probably be best to address that to BNDD since it's their statute.
Probably. Someone's asking a question about the Class O automated dispensing rule that the board approved. Again, we are working to have this filed. We've done an initial submission, doing some revisions before we officially submit to the Secretary of State's office and the governor's office. The question is, will a pharmacist be required to be available for consultation? The answer is yes. Additionally, a pharmacist would need to be able to access the Classo site within 30 minutes as well. Pharmacists would also have to be required to be available via video and audio for consultation if the system is fully electronic.
Someone inquiring about the COVID vaccine, if it was approved under an EUA, is the board still considering that FDA approved?
I think so, yes. I think we are. I think the statute may actually use the words approved and/or authorized, the new language. So I think it would fall under the authorized language. But we, of course, would have to consider that going forward should it come up again. But I think the new language does say approved and/or authorized.
Yeah, it does use the word authorized.
Okay.
So, more questions on fentanyl test strips. Who should we contact? I would contact BNDD. You can email them at bndd@health.mo.gov. Also, I would recommend consulting an attorney if you have legal questions about them.
We'll give a few minutes. I think we've come almost to the end of most of our questions. If you still have a question, please enter it into the chat box. We have about maybe another minute or two. Again, please monitor the board's website. Please read the practice guide supplement. Also, this webinar recording will be posted. I think it takes maybe a couple of days to do so, but it will be posted on the board's website if you would like to listen again on demand. On-demand listening is not eligible for CE, but you will be able to provide the information.
Someone's asking, has the board issued any clarification on the recent update from the DEA on initial prescription transfers?
We have not. I think that would come from BNDD.
Someone wants to know whether the slides be posted to, the handouts are on the board's website or on your GoToWebinar toolbar right now. You can get those there. They'll be on the website for another day or so before they get taken down.
There's it.
Someone wants to know, will BNDD need to update their regulation in regards to C2s? I assume all the things you talked about with mid-level practitioners. I don't know that they would have to ask that. A lot of that is in statute, not in rule. And since the statute changed, I don't think they will, but that would be a question for BNDD.
So there's a question about a EpiPen if someone, for patients that may present at the pharmacy, if you need to use one. There's some guidance on that, I think, in the practice guide. I would refer you to the practice guide for the guidance on that. If you have additional questions, please email the board office or submit it to the board's email address. There's some additional information that we would want to share with you that may be a little bit lengthy for this webinar and this Q&A setting. I think that may be the end of the majority of our questions. As always, if you have additional questions after the webinar, please email the board office, MissouriBOP@pr.mo.gov. That is on the board's website, and we'll try to answer you as quickly as we can. Also, please, if you have not signed up for the board's e-alerts, because we believe a lot of additional information will be coming out over the next couple of weeks about legislative changes. Please make sure you're signed up for the board's e-alert. That is not just for pharmacists, but managers, techs, and everyone as well. I think Tom's got one more question that came in. No more questions. All right.
We need to close this out.
Thank you, everyone, for attending.
Our next webinar will be September 21st. We'll have our annual compliance update with an extended question and answer session with some of the inspectors on that one. As I mentioned earlier, we do record our webinars. It can take up to 15 days before they get posted, and we'll post them on our website. And we have 3 other ones we did this year already posted there. You can see what we have: technician update, drug distributor, 3PL update, and then Mo HealthNet came and gave an update. If you're interested in obtaining continuing education, you must complete the post survey. So do not close your browser. When I announce that I'm going to close the webinar, a little screen will pop up saying that I'm going to close it. You need to click close on that screen, but again, do not close your web browser. And then the survey will then open. You answer the questions and click submit. If you do not get the questions, and we hear that happens sometimes on mobile devices, you can email us at compliance@pr.mo.gov, and we'll email you the questions. However, you must have the answers back to us within 24 hours if you want to get CE. A reminder again, we will email your certificate in approximately 30 days, and save your certificates because we do not report to the CPE monitor. So we'd like to thank you for attending today's webinar.
Thank you, everyone.
I am now going to close the webinar.